Assalamualaikum. I'm back. Okay. I've actually completed my chemotherapies. I went through 4th cycle finally. My last vlog update was, I think, about July or June, around there. Oh, it's June. Yes, it's June. So, yeah. So now it's coming to October, and I already completed my chemotherapy. Alhamdulillah, so far I'm good. My third chemotherapy was okay. Um, it wasn't that good because I've not been. I think, yeah, I've not been taking care of myself that well. I have no appetite. I lost my appetite, and I kept on vomiting with whatever I ate. So I actually fell weak, and then at the same time, I'm quite stubborn, so I didn't really follow whatever the doctor advised, like don't go out to crowded places, etc., etc., etc. But I still go out and all, but yeah, so I suffered on my third chemo. Yeah, it actually will go through, if you're not strong the week before, and during your chemo week you did not actually take care of yourself the week before, then your body will get weaker. So yeah, I've learned from my third chemo, and then when I went through for my fourth chemo, I actually told myself to really heed the advice, and yeah, I went through well for my fourth and last chemo. Okay, actually, I doctor told me that most probably I only have three chemos therapy cycles, sorry, but then it ended up four because the doctor just want to be safe, in case the cancer cells try to want to live in there again. So she would just want to make sure that it really died there and stopped there, and make sure that it will not spread anywhere else. So I went for the fourth one just to make sure. So after the fourth chemo I stopped, and then the doctor said, okay, your the one that is already affected at my fallopian tube is actually shrinking from 3 cm to 1 cm, and so far it has been there 1 cm for quite a while, and it has not been moved. It has not been increasing its diameters. So doctor told me that they just want to monitor, and if it's not increasing on its length or anything, whatever it is, then that means let it be. But if it's actually growing, then I have to go through for another operation. But so far, it is okay. It's good. Yeah, good. And yeah, I'm doing well so far. So after the chemo, I actually quite excited. So I decided to I declare myself healthy, but actually I know myself that I'm actually quite weak still, because I just ended chemo for about what, 2 weeks. So I so-called self-declare myself healthy, and I tell my friends, hey, I can just um, join you guys for an event. So I went out for I think I went up to a event, and then I got it was a crowded place, and then I got caught with a flu. I do not know where I got it from, but I suspect it from the crowded places that I went to. And at first, the flu was okay, and then it went bad. It went from a normal flu to coughing, coughing to asthma. Remember, I have asthma. Yeah, my asthma actually returned. So from flu to asthma, from to coughing, and coughing to asthma and eczema, all that, and then and I had fever. So doctor did tell me, if I have fever, please call the hospital and immediately report to the hospital. But I refused to. I just keep quiet because I do not want to go to hospital anymore. To me, well, why should I already completed my chemotherapy. I have enough of going to and fro of hospitals, you see. So but I'm quite stubborn actually. So I went when I went for my appointment. I was quite weak, and my doctor realized that because I already get the flu before that, a very slight flu, during my last chemo on a few for a few days, and then the doctor was like, "Why isn't your flu getting better? It has been about what, 3 weeks, and you are having fever and you are not calling us. You didn't actually report to us until today." So I got some scoldings from the doctor. So, well, yeah, I'm a bit stubborn. I agree on that. um yeah, so the doctor told me that I need to be admitted because she's afraid that there's any infection, and she wants to check whether one of the chemo drugs, which is bleomycin, actually can cause lung damage to my lungs. So actually, I went for X-ray, and yes, it is actually a bit damaged on the base on my right side of my lungs, and the doctor said I was born with small lungs, and therefore my lungs is quite fragile. So yeah, it was minimal though, and they are not sure what kind of flu I was getting. So I was actually placed in the um, what they called it, the ward where you have to stay alone. I forgot what they call it. It's okay. The ward. I have to stay in the ward alone. Just because they think that I have H1N1, and I was like, no, not another one. I mean, I have done with my chemo, and I thought I would get better, and now you say you are suspecting me with a lung damage and and what, a H1N1 flu. I was pretty upset. I got depressed actually. I was so sad. I cried in a room alone, and people have to wear masks when they visit me. So I was like one after the other, but again, I thought I prayed a lot, and I hope that this is not anything serious. So I stayed there in August for a week, and and yeah, finally the doctor say yes, my lung did damage, but is a very minimal damage, and it will recover by itself. And also uh, I was H1N1 negative. It was found negative, so it's just a normal flu. It just take time to recover because I have due to low immune system. So yeah, so Alhamdulillah, I'm better. So after a week, I was discharged without chemotherapy. I feel happier. I stayed at home about a week, and then I started going out, and then there I go. Yeah, then I started going out, and a few weeks after that, I started my job and started my normal life again. Alhamdulillah, I was quite happy and that I got during better. My chemo process, KK has actually this volunteer group where you can join for cancer patients, and there were four of us, which were handpicked by one of the staff nurse, and I actually joined a painting class. It's more of a painting class and sharing session, where it's an art class actually, where they will ask you to do clay. I mean, just do some clay art, painting and all. I'll show you some pictures later of what I did. And at the end of the day, they asked us to create it based on our feeling and our emotion, what we are feeling about our sickness right now, uh, um, the pace that we went through and all. I think it's awesome. At the end of the session, we will share with other cancer patient. Sorry, there's five of us. We'll share with other cancer patient about what we feel, and I feel that I'm not alone. I mean, when they share with me, because all of them were ovarian cancer patient, and they are survivors. They are about 10 to 20 years survivor, and if they can, I can too, right? So talking to them was good. Was that satisfaction that I got to talk to them, and when they share the same thing about how they felt, I was like, yeah, I felt that exact thing too. So yeah, they told me it's normal, and I asked them a few questions like, when does my hair will grow back? Well, my hair is growing back to normal slowly. Yeah. So so yeah, I did do the painting for about a few sessions, about 8 sessions, I think. And they will, and then they gave me a journal where I have to record it and submit to them at the end of the day. So I did submit to one of the doctors, and they will compile all our story and all our artwork and make it into one book for people to share. So if the book is out, I will actually show it to you, right? Okay. Um, yeah, I think it wasn't that bad. I hope I am fine. I just went to because I am now on follow up with my doctor every 2 months, and if it's okay, then we'll extend. I mean, it will go about from 2 months to 6 months, and 6 months to a year. And currently, it's just 2 months, 2 months, 2 months. I will see my doctor. I will go KK for an appointment. So I recently I just went for my first appointment after chemo, everything. My doctor say everything is okay, everything's normal. She just want to look for another CT scan to make sure that there's really nothing inside my body. So my key to everything is to be happy and less worry. Just relax there and know that everything will be okay. When your new cell actually grow, your skin gets better as long you have to eat good food, nutrients. All right, you have to eat good food. So I try to practice my good food. I try my best. Yeah. So yeah, if you believe you can, if you believe that you are getting better, whatever sort of problems that you are going through, just have faith and be strong. And I believe that when you have that in mind, and you know that you will get better, everything will be just fine. It's all in the mind. Yeah, really. So I'm going to share you my drawings and my paintings of the that I went to for the session art class. So it's not really that nice, but yeah, just sharing. Yeah. Okay, I'll see you soon. Goodbye. Assalamualaikum.
I was so far from you, yet to me you were always so close. I wandered lost in the dark. I closed my eyes to all the signs you put in my way. I walked every day further and further away from you. Ooh, Allah, you brought me home. I thank you with every breath I take.